Hi, my name is Adalberto Olivares. I work for Sasi, a Mexican software company focused on developing electronic and digital security software. I was wondering if you know what lupus is. Well, lupus, for those who don't know, is an autoimmune disease. It causes the immune system attack healthy cells by mistake and damaging many parts of the body. I had a sister who suffered and died from complication provoked by lupus. It's just an horrible disease. One of the occasions I was accompanying my sister at the hospital, I started fighting with them because she wasn't treated with the promptitude required. The response that I got from them is that they couldn't treat her at that precise moment because they couldn't find a portable peritoneal dialysis equipment, arguing they used to have it at the hospital, but they didn't know where. It took more than a whole day to realize the device has disappeared. It has been stolen. My sister's illness forced me to visit several hospitals across the country, even private and public. I had the opportunity to suffer the lack of medical devices several times. After my sister died, I continued with my life, working in the technology, several technology companies in Mexico. All those events remains in my subconsciousness until a few years ago that I crossed by public news that was mentioning at that moment the impact of more than $20 million provoked by the theft of medical equipment in only 1 year at the public sector hospitals in Mexico. Okay? That event and that news motivated me to study the subject further, and I found three very important aspects in all this study. Working with a Mexican recognized private university named Universidad Anáhuac, in order to determine which are the medications and medical assets that worth the effort and the investment to keep them and to protect. We found a study published by an association named Mexican Against Corruption. The study name was Deteriorated Health. And that study mentioned two important aspects. One is that 62% of the personnel interviewed in the several public hospitals indicated problems of the theft and unauthorized loans of equipment supplied by medicines. Also, 37% of the interviews mentioned the continually suffer abandonment of the hospital facilities during the shift, and also in absentees and the inability to pay immediate attention to patients derivated from personnel leaving the workplace. All of these problems and efforts directly impact the opportunity to provide a real quality service, to really provision healthcare services with good quality in Mexico, okay? And also to be not able to comply with the objectives of the patient safety program issued by the largest Mexican security system, which is the IMSS, okay? That seeks to increase the security which patients are treated and medical service provided within hospitals. There are also in that study some mentions about technology available within the world. We also study some providers of real-time location systems in the US and Europe that has developed verticalized products focused on medical devices tracking and hospital personnel localization. I reviewed several of their offers and found them that are most of them unaffordable for the Mexican public hospitals. Also, the short board budgets of those hospitals do not allow to gain us access to that technology. Okay? With all that information that we study, we at Sasi develop a software and hardware product that tracks and controls people and assets within hospitals. We named that product already HealthCare. It's a hospital security and control system. The first version of this product has already been developed. We are currently in the pilot customer implementation process, and at the hospital in the Toluca city in Mexico, which is a public and private hospital. Okay, HealthCare includes software also to register assets, people, and the hospital areas. In addition, it has a software engine embedded that validates and sets rules that ensure the assets and the personnel are moving together jointly across the hospital, and the assets can only be used where they are allowed to be. Okay? In addition, we develop a pair of electronic devices that use RFID technology to sensor the location of people and assets, link it together, and communicate their sensed position in real time using the hospital Wi-Fi network. Okay? These help us avoid the need to place an additional network, and these also reduce the cost and avoid wiring hospitals, which in Mexico is really difficult, or in most cases prohibited. As soon as we finish that stage, we want to have the support of a carrier such as NTT, for example, to help us implement a chip that uses narrowband IoT technology, not only to control and track the equipment within the hospital indoor, but also outdoor, in a hospital campus, for example. We have already started talks with several public healthcare authorities in Mexico, and they foresee a pretty good opportunity for this product to diminish the theft of medical equipment, to help them enhance the medical assets protection, and to increase their alignment with the patient security program, their key objectives, and more. This is an opportunity for more than 230 hospitals within country. Thank you very much.